Global Nurse Solutions Initiative that we've been holding with our colleagues at Sabin. And I'm delighted to see you all today. I don't know where you are in the world, but I'm in Scotland and we have a bit of snow at the moment and it's very, very cold. So hence I've got my lovely big jumper on. It's lovely to see you and thank you for taking the time of joining this really important session. As I said, it's the third one. And to recap, for those of you who know about Nursing Now Challenge, you'll know that we are a global community that looks to support and develop early career nurses and midwives, and also student nurses and midwives. We cover all 6 regions of the world, and we have our fantastic Challenges Committee, who hopefully will be engaging with you in your region. The Global Solutions Initiative is a long-standing programme or element or initiative that we have within Nursing Now Challenge, and it has proved hugely successful. It is an opportunity for you as a nurse, as a midwife, as a student to take control of something that you think needs to be changed or needs to be raised as an issue or requires innovation or basically has an impact on the health of our communities, our population, etc. And this is no exception. If you've been lucky enough to attend the previous sessions, you will know that. But I won't say any more because Marissa, who is the senior manager of the HPV vaccination and initiative, is joining us live from the USA. And she, like in other sessions, is going to expand, explain, and give us some more details. She will have a recap, and then we will hear from, as always, the people who are making it happen, yourselves. We have great guests today, and we really are looking forward to hearing their inspirational stories. And we also want to hear from you. So please put something in the chat, say hello, tell us where you are in the world, ask us questions, and we will pick up with them later on in the session. But to try and keep on time, which is something I'm obviously not very good at often, I'm going to hand over to the wonderful Marissa to take us into this next part of the recap of the challenge and the key points covered so far. Thank you, Marissa.
Thank you, Aisha. So great to see so many familiar faces back here again, and welcome back to session 3. If this is your first session, I'll reintroduce myself and also go over some of the things that we've already recapped in the first and second sessions, and then we'll add in a little bit of new at the end. So hello, everyone. I'm Marissa Malchione, and I work with the Sabin Vaccine Institute. And we are a global consortium that is a movement to prevent HPV infection and to drive action towards the elimination of cervical cancer as a public health concern. So just to bring these stats back up, because I think they are so poignant, that the global impact of cervical cancer is where over 600,000 women are diagnosed every year, and 350,000 do not survive that disease. And unfortunately, those numbers are continuing to rise. And so we had looked last time at those numbers and the impact by region, and we saw that Africa and Latin America and Asia have the highest rates of both new cases and deaths. And we also discussed the inequities that exist that make that burden of cervical cancer worse in certain regions. And so we pointed out that the incidence rate, or the number of new cases over here in orange, is 4 times higher in Africa compared to North America. And the mortality rate, or women who die from that disease, is 8 times higher. So once again, pointing out those higher rates of women who are not screened or treated, and therefore their lives are not saved from this disease. We've talked before about how now the WHO has declared that in order to eliminate cervical cancer, all countries need to provide services across each of these 3 pillars, and that is vaccination, screening, and treatment. And I will recap that very high-level overview of each of these 3 pillars from the last session too, just in case this is your first session. So jumping into that, of course, we have the HPV vaccine as our primary prevention, and it protects against cervical as well as a number of other cancers, and it's best given before exposure to the virus. So exposure typically occurs with sexual activity, and so before debut of sexual activity is when that vaccine is most effective. We talked about how there are different strains of HPV, and so different vaccines have different strains incorporated in their formulations. And we know that HPV 16 and 18 are what we call those high-risk strains. So most vaccines will include those in their formulation. We also talked about who is eligible. So that varies from country to country based on their policies, but typically we see that adolescent girls aged 9 to 14 are eligible. In some countries, they also include males in their target population for vaccination, since we know that males are carriers of HPV and also susceptible to some of the cancers that it causes. So in terms of doses, this also varies from country to country based on their policies, though typically 2 doses is recommended, and that is separated by a period of weeks or months. Some countries have now introduced a single dose approach, where 1 dose is offering full protection for healthy adolescents, but those that are at high risk, such as those living with HIV or those who have other experiences of being immunocompromised should still receive 3 doses, again, separated by a period of weeks or months. I think it's always important to talk about the side effects because we want to be transparent about what patients may experience if they are vaccinated. So there are mild side effects that are very much like those associated with other vaccinations. So pain, redness, or swelling at the injection site, a mild fever or headache and tiredness, slight muscle or joint pain are things that someone might experience in the hours or days post-vaccination with HPV. So now moving on to the secondary prevention, that's screening. And we talked about how there are different types of screening mechanisms offered to women. And generally speaking, those identify either the presence of HPV itself or the cellular changes that happen to the cervix when HPV is present in a persistent fashion. We talked about how full cervical cancer requires really intensive and invasive treatments that are often hard to access in many LMICs, but also leave a really lasting impact on women's quality of life. And that's why it's so important to identify the presence of HPV or those changes to the cervical cells early, so that those early management options can be employed, which are much more easily tolerated by women and have much less harsh side effects and effects to quality of life. So I won't go into this full detail again, but definitely recommend checking out our prior recordings. But just to give a brief overview or snapshot of the most common types of screening methods, we have HPV DNA screening, we have visual inspection with acetic acid, and then there's also the pap test. So these are different approaches. Some are performed in health centers by clinicians, others like the self-swabbing for HPV DNA, which is becoming more and more available, could be conducted at home, but they all have different approaches and different ways that they are examining for potential disease. So again, when we think about eligibility for screening, WHO recommends that women are screened for cervical cancer every 5 to 10 years, beginning at age 30, but that again, those women who are living with HIV should get screened every 3 years, starting at age 25. And then lastly, we talked about treatment. So that importance of management and early treatment, how important it is for women who are screened positive to be connected to appropriate management or treatment services. So typically after testing positive for a high-risk HPV DNA strain or receiving a positive VIA test or pap test that shows those abnormal cells, women may be referred to a colposcopy, which further evaluates the cervix for abnormalities and can involve a biopsy. And that based on that, women will be referred for next steps. And those examples of treatment of precancerous lesions, so those early treatment options, include things like cryotherapy, thermal ablation, and they use different techniques to basically dehydrate the cells or the tissue to rid them of the HPV infection and the abnormal cells. And important to say that both are typically performed without anesthesia. There's mild discomfort, but very short recovery time compared to the alternative of a full treatment for cancer of the cervix. So now, what role do nurses play? And nurses and midwives are really trusted members of communities, and so they play a really critical role as champions for HPV and cervical cancer prevention. Now, before we get into sort of what some of those key strategies are for nurses, I think it's important to always think about the level of awareness. So, in order to be that champion, it's important to recognize that the level of patient awareness and acceptance for HPV preventive services sort of exists across a spectrum. So, we hear time and time again that often there is this sort of even lack of awareness or knowledge where patients may not even know what HPV is, they don't know that it can cause cancer, and they don't know that there's a vaccine or screening that can prevent that cancer. So they operate maybe up here on this part of the spectrum. We, of course, have those patients at each end who are fully informed and want to partake in those services and come into the clinic ready and asking for, demanding those services. And then we have those who have made up their mind. They have declined. They don't want anything to do with it. But in the middle, it's really important to consider where on the spectrum your patient exists and be able to meet them where they are in that conversation to have the most successful outcomes. And I know our nurses on the line today will be able to speak to that really, really well. So again, there are those who don't know, that need new information. There are those that have heard about it but might have questions. And then there are those who have received misinformation or incorrect information about the safety and effectiveness of these services, and thus might need more in-depth conversation to correct some of those rumors or incorrect pieces of information that they have. So now onto some key strategies, and here are a few strategies for nurses and midwives to advocate for HPV vaccine screening and treatment. So first, where do we sort of begin? And step one is what we're all doing here today, and that's educate ourselves. So really having that comprehensive understanding of HPV, how it's transmitted, what cancers it can cause, and the effectiveness of the vaccination screening and treatment approaches that exist so that patients' questions can be answered in a really confident way. The second is to be one who proactively initiates that conversation. So when you are speaking with a patient, they may not bring up HPV vaccination or screening, but that is where the nurse and midwife role comes in to be a proactive advocate and really actively ask about their HPV vaccination status, initiate that discussion of the vaccine's benefits and the reasons that we want to screen early and often. And then lastly, normalizing those prevention services. So present the vaccine, for example, as part of a routine and standard of care for adolescent immunization, similar to other vaccines that are received during childhood, or that screening is something that is normalized and something we need to do regularly to maintain our health and longevity. Then we talk about how to communicate around this. So we want to first address those concerns effectively and make sure that we can be really direct in the way that we talk about these things. So be prepared to address some of those more common misconceptions and concerns regarding vaccination, screening, and treatment, such as those concerns about safety or worries about stigma and perception and why the vaccine might only be eligible for girls. So it's important to be able to address those concerns directly. Tailoring the language to the patient speaks to the slide that I said that I had up previously, where we adapt the language and our explanations based on where our patient is, and we sort of meet them where they are. So depending on their age, their level of understanding, their cultural or religious background, we want to tailor the language to be most appropriate to resonate with them. And then we also, of course, want to make sure we're providing accurate information. And if it's possible, to distribute credible educational materials, pamphlets, a flyer, something that they can take with them that has some facts and details and reliable resources on it that they can look up for themselves. That's also really helpful for them as well. And then our last group here is really thinking about what can nurses and midwives do beyond the examination room. So of course, being able to advocate for policy changes within your health setting is really important. So there might be opportunities to support or promote automatic reminders or standing orders or other things like that within your health system that help to bring patients into the clinic for these services, but also prevent that loss to follow-up that happens between screening and treatment and management. It's great to collaborate with your fellow healthcare providers to make sure that there is consistent messaging about vaccination screening and treatment, because a patient might not always see the same provider every time they come in. And so ensuring that no matter who they're speaking to within the clinic or the system, that they are getting that consistent messaging is really important. And then lastly, this community engagement and outreach. If there's opportunities to participate in school events, health fairs, community forums, and spread your knowledge and educate the public around vaccination screening and treatment. As I said, and as I started this all with, you are all such trusted members of your communities, and parents and adolescents really look to you all for direction and advice. And so being able to engage even outside of the examination room is so important. And then ultimately, it's key to remember that we need to respect the patient autonomy. So we listen to their concerns, we address their questions openly, and we allow our patients to make informed decisions about vaccination screening and treatment. Now, I know our speakers today are going to share their experiences for how they provide strong recommendations for vaccination screening and follow-up, and I'm really excited myself to hear about all of that. And hoping that we can continue to share and exchange what's worked best in different contexts to reach patients and resonate with them. So now I'm going to just wrap up by recapping our challenge question and sort of how we can all participate in the concept note challenge. So through this Global Solutions Initiative, we have this opportunity to sort of contribute to these new areas of thinking around acceptance and uptake of these preventive services, and think about creative, new, and innovative ways to decrease the barriers to access and improve acceptance. So the challenge question for this series is to create a concept note that crafts a solution to increase the access, acceptance, or uptake of HPV and cervical cancer preventive services among adolescents and women in your community. So that could be around vaccination, it could be around screening, it could be around treatment, it could be around all three or two of the three. And so we wanted to just reiterate the question and also reiterate what types of solutions you can address. So I definitely recommend looking at some of our prior recordings, because we go into a lot of detail over the types of issues your solution could cover. And we also wanted to just call out again that if HPV vaccination has not been introduced into the national immunization program in the country that you live in, that's totally fine. You can still participate in this challenge. And we would just recommend that either your solution focus on improving access and uptake of screening or treatment, or to develop a strategy that would prepare communities for introduction and availability of the HPV vaccine when it does become available, because it is really important to make sure that adolescents and parents are excited and informed about those things before they roll out. So again, we definitely encourage checking out the Facebook page, which has a lot of resources that can help inform your submission, and then the recordings of session 1 and 2. So the concept note, the due date for the concept note is December 13th. We do plan to have one more session on December the 5th, I think it was, Hannah, but you can correct me if I'm wrong in the chat. And that one we can create sort of a working group session where we can answer any final questions you all might have on your concept note before that December 13th submission date. And then just finally, the winner, we will select a winner, and they will be invited to attend the Global HPV Consortium Partners meeting that we will hold in February of 2025. During that time, they can present and receive feedback on their innovative ideas from our really fantastic group of partners. So we have partners that almost reaching, I think, 60 now. We have 60 partners of the consortium. They operate across the globe, from country-based experts to implementers, service delivery folks, researchers, and so many more. We'll also record that presentation and we'll put that on our Sabin and the Nursing Now Challenges YouTube pages, promote that on social media, and really give a platform to you and your fantastic ideas and the work that you do in your communities every single day. So thank you so much. I'll be back on later to talk about our third mini challenge, but for now, I'm going to hand it back to the Nursing Now team. Thank you, everyone.
Wonderful. Thank you so much, Marissa, to have that wonderful recap. And we have had a lot going on in the chat alongside this. We have got fantastic individuals from wonderful organizations across the world. So to not lose any time and momentum here, we are going to now hear experiences from the field, as Marissa says. So the roles of nurses and midwives in creating and implementing strategies for awareness raising and promoting acceptance. And we have two fantastic speakers today. We have Fatima Salah, who is a registered nurse in Sudan. And we have Rashid Manganda, who is a registered nurse in Malawi. Now, we know that Rashid was having some technical issues, so hopefully we will be able to hear from him. But let's first of all move to Fatima. Fatima, would you like to share your experience with us? Thank you.
Yes, for sure. Thank you so much, Dr. Aisha, and all the Nursing Now Challenge team. Really, it's my pleasure, and I'm honored to be here today and sharing my experience. Okay, can I share my screen?
Yes.
So
we can see this, Fatima.
Okay, thank you so much. I'm Fatima Saleh, a community nurse from Sudan and a founder and CEO of Sudanese Nursing Leadership Initiative. And I work now as a project administrator in an Italian organization providing humanitarian aid in Sudan. So now I would like to share with you some figures, numbers about HPV and cervical cancer in Sudan. And I will share also what we did. Sudan is located in Northern Africa, and we have about 13.8 million women aged between 15 years and older who are at risk for developing cervical cancer. Unfortunately, every year we have 1,227 new cases of cervical cancer. 828 women die from the disease. And cervical cancer, it's ranked like the second leading cause of cancer deaths among female cancer deaths in Sudan, and also the third most frequent cancer among women between 15 and 44 years age. The statistics show that 98.7% of cervical cancer cases in Sudan are related to HPV type 16 and 18. And unfortunately, we don't have HPV vaccine available, not introduced yet in our national health system. And also we lack of national screening program. Previous to the war that's ongoing now in Sudan, we have limited access for screening services that driven by NGOs or private sector, and it's not accessible for everyone, and it's very, very expensive. And now even those limited access, it's not available due to the devastating consequence of the war. As you know, we are going through conflict since 2023, and we had devastating consequence impact on the fragile health system. Over 5 million people have been displaced all over Sudan, and the majority of them, they are women. They are living in poor conditions and lack of medical facilities and health care in gathering points and shelter. And I deeply believe always difficult time, it's a chance of a big change. So we work on Sudanese Nursing Leadership Initiative, and we take this like a chance. We have thousands of women in one places, and this has helped us to overcoming the challenges of distances and also cultural alliances. So I will introduce to you Sudanese Nursing Leadership Initiative. It's initiative that aim to support nurses, raise their leadership skills, and to support them to take a very effective part in health promotion and improving 2020. When I felt an urgent need that nurses, they should be more involved in health promotion and disease prevention in Sudan, as we are facing a lot of communicable and non-communicable diseases, and also we are facing the impact of climate change. Advocate for nurses to take this part by training them on leadership skills, different urgent public health issues in Sudan, to take the lead and to lead community awareness campaigns. This is part of the training that we conduct for nurses and midwives. Here also. And also we conduct forum, we invite international organizations that are working on health in Sudan. And we conduct many forums discussing the importance of involving nurses and midwives on the surveillance system in Sudan. I didn't expect actually to reach all of this, but I'm proud to say that I reached 16 Facebook page, and I trained over 500 nurses on breast cancer and cervical cancer awareness, and they disseminated these messages of preventive tool and early detection measurement for over 5,000 Sudanese women across Sudan. And those 500 nurses, they lead initiative to support sexual and reproductive health for women and to separate this in the community, and they lead themselves community initiative. And also they organize awareness campaign in school of girls to disseminate the message of cervical cancer, HPV vaccines, and also sexual and reproductive health. And this is also part of our campaigns on community to empower more women to take part of this. One of the challenges that I observed during this journey, it's gap in knowledge, not just on the community, but even on the healthcare workers, even nurses and midwives. They lack the necessary knowledge, and they don't know how this is serious issue, and they preventable, and they can take a very important role. Additionally, at the same time, we face significant cultures and social barriers and misconceptions, so that one of the things that we take to overcome these challenges is to provide nurses with knowledge, and also not also just knowledge, leadership skills and confidence, so that they can navigate these sensitive topics effectively. The second thing that to integrate HPV vaccination into our national health system, like Sudan and many countries, they don't have yet HPV vaccine on their system. It's this decision, it's not take like lightly or in isolation. So we need to require foundation built on strong advocacy, database, impactful researches, and we need to demonstrate the readiness of our community to receive this vaccine. So wherever you are hearing us and what you can do for this, you have to take this serious problem for more advocating to in our national health system by strengthening this case of making HPV vaccine a national priority and ensuring sustainable part of the health system. Thank you so much to connect with all of you guys, and I'm happy to see how you can navigate and how you can support your community and nurses all over the world to take the lead for this initiative.
Absolutely wonderful, Fatima. Thank you so much. I mean, hugely inspiring, and anything is possible when we listen to you. And we see in the chat everyone saying how wonderful this story is of courage, of commitment, of never saying anything is impossible, and hugely inspirational for all of us. Okay, straight on to, if possible, Rashid. Rashid, are you able to join us today?
No, I don't
hello.
think that. Oh,
Can you hear?
Yes, yes,
amazing.
we can hear you. Okay, this is wonderful. We can't see you, but if we can hear you, that is enough.
Yeah, I think I'm having problems with my connection, so I think you may
Okay,
not be able to see me.
no
But I'll be
problem, no
trying to
problem.
connect.
Over to you. Over to you. Tell us, share your experience. Thank you so much, Rashid.
All right, thank you so much. I'm Rashid Manganda. I'm a registered nurse from Malawi, and I'm also immunization advocacy champion 2021. So I'm here to share you my experience in raising awareness and acceptance of HPV vaccine. So in recent years, Malawi, we have been struggling really to increase the acceptance of HPV vaccine, mainly because of beliefs, traditional beliefs, religious beliefs, and also need. Most of the parents did not see the need for HPV vaccine, and also mistrust towards the vaccine. Maybe because of the COVID-19 vaccine, people associated the HPV vaccine and the COVID-19 vaccine. So because of these reasons, we've been really struggling to raise the acceptance of HPV vaccine. I remember this other time in late 2022, went at a certain school with my colleagues to administer HPV vaccine. So there we met before the exercise, we met the teachers and the students, the adolescent students, to give them information before the administration. So we stayed with them like over 30 minutes discussing about HPV vaccine. So it was surprising after this long talk, no child came forward to receive the vaccine. So I was interested to know why are the children not coming forward to get the vaccine. So I had to interview one of the children who said their parents told them not to receive any vaccine from school. That's why we noted the gap. We missed a big step of raising awareness in the community first before going to schools to give out the HPV vaccine. So here's what we did. We had to sit down and think the strategies of improving the awareness in the communities and across the whole area. So we organized the campaigns, which included the health promotion and the administration exercise itself. So on awareness, raising awareness, we had mobilization exercises, which included engagements with faith leaders. So we had to visit the churches, putting on the uniforms. We used the nurses' uniform as a tool to attract the attention from the congregation. So we gave out the information about cervical cancer and HPV vaccine. And also we met the local leaders in different platforms. We also had to organize meetings in different schools across the district where we met parents together with the teachers to give them information about the HPV vaccine and also cervical cancer. Then at the end also organized the community awareness, where we had, because of shortage of nurses, we had to recruit some village volunteers and we trained them on health promotion, and they went in the communities using the megaphone, giving out the information about HPV. And into a campaign, we had also to go with these mobilizers. They are doing door-to-door campaign. Before us visiting there, they reached the homes first and organized the households if they have their adolescent who required the immunization. The HPV. So aside from the campaigns that we held, nurses were so key in giving out information about HPV and cervical cancer in antenatal care and postnatal care areas, and also we utilized teen clubs and family planning areas where also we could give the HPV information, and also the areas where we offer cervical cancer screening. Before the actual screening, we had to discuss with the women there and also give them information about the HPV. And later on, also had to distribute posters which had information about cervical cancer and HPV pasted in schools, markets, and health facilities. So these are the things that we did that helped to improve the acceptance. So now I can confidently say that in my community we have high acceptance rates almost in 15 catchment areas. Most of the facilities they have 95 to 100 acceptance rates because of the activities that we did. So I'll finish with the example that I always like to give. I always say nurses or healthcare workers are the key to giving out the right information to the community to accept the vaccines. When we are doing polio vaccination campaign, we had this other healthcare worker who had a child who was eligible to receive the vaccine. This healthcare worker told the wife that when the vaccinators come to the household, she should not let the child get vaccinated because of their own reasons. Yeah, but him as healthcare, he was also part of the campaign. He had to take the vaccine and vaccinate other children to other homes, but he could not let the child get vaccinated. The vaccinators reached the household. The woman refused the vaccine. After that, the woman went to the borehole and met the colleagues who asked her. They were discussing about this polio vaccine, and then the woman told the colleagues, no, I haven't vaccinated my child because my husband instructed me not to have the child vaccinated. So these other women, they had the information from a wife of healthcare workers, and they circulated the rumors that the vaccines are not safe. So they should not let their children also get vaccinated. That's how dangerous information from a healthcare worker is. So thank you so much for having me. Thank you.
Wonderful, Rashid. Again, very inspiring. Thank you so much for being persistent and staying with us. We couldn't see you, but we heard you loud and clear in your messages. As time is moving on, I want to go straight to our next wonderful speaker, Dr. Pedja from People Power Health, who has been a wonderful contributor and supporter to Nursing Now Challenge, has guided many of our early career nurses in this idea and the power of storytelling, which actually I've just come off a call with WHO and the State of the World's Nursing Steering Committee. And that was the last message that Dr. Campbell gave us about how do we take the story to the world about the state of the world's nursing data. So wonderful that Pedja, I'm going to connect the both of you because this could be a great collaboration. And it's interesting how he was saying, this is the important piece. We need to know the story. So please, thank you so much for joining us. Over to you. And we are looking forward to hearing your story.
Aisha, it's really amazing, and it's great to be here, like for many years, and it's also good to see some of the faces and people we trained. Well, I'm not seeing the faces; I'm seeing the names. So maybe my name is Peja Stojcic. I'm the executive director of People Power Health, and I'm also faculty and a professor at Harvard Chan School of Public Health. What I was curious about, like if people are willing or capable of doing, just it would be nice to see some faces. So if you can turn on your camera just for a bit, just to see who is in the room. It's always nicer to see faces instead of the black rectangles. Okay, good. Like, great to see you all. Hi, Fatima. Hi. Yeah. Hi, Rita. Oh, there you go. Like, yeah, the familiar face. Now, and look, if the connection is not good, and like, hi Rashid, like it's so good to see you again. So if connection is not good, you feel free to like turn it off. But like it's always nice to see faces as we do this work together. So I'm gonna quickly present, and this is not going to be a more elaborate presentation on the idea of storytelling and narrative leadership, but more than happy to connect with all of you later on and kind of like think through how these things and these concepts could be introduced to you. This whole concept of narrative leadership, and I teach a course at Harvard about this, is about the idea that in order for us to do some work together, to cooperate together, people need narratives. Because one of the things that people argue, and Yuval Noah Harari, who wrote an amazing book called *Sapiens*, that distinguish us from other species is our ability to use narratives and stories to actually collaborate on a scale. And many of you know what I'm talking about because you're a global movement of nurses. And having a narrative, having a story that enable us to work with each other despite we are in different places and find a common ground with each other, that's what narrative does. That's what stories do, is giving us this kind of like sense of like, yeah, we can collaborate on a scale, even if we are in different parts of the world, or sometimes we are disconnected. And in healthcare in particular, it's even more important. And Aisha, I really liked what was the comment of the one of the leaders about what people need. And if you think about this slide, like when you think about data and information can be organized in many different ways. You can have just pieces of data. It can be sorted. It can be arranged. It can be presented visually. But what narrative does, it gives people meaning of the data. And like that, the story is the house, like the same pieces of information without the meaning, without the story, can be interpreted in different ways. And when I teach students in public health and this work with clinicians, we work a lot with clinicians globally. I always say that there's a sense among us, among health professionals and clinicians and both nurses and doctors, that in order to fight some of the false information or false narrative, we need to give people more data, more information. I want to make an argument to all of you that, yes, that is important. We should be grounded in evidence-based medicine, and that's what we are, as a profession, that's what we stand for. But if people have a false narrative about something, we cannot fight that with more data. We need to give them a different narrative, an alternative story, a way to interpret the meaning of the information in a different way that can enable them to take different choices and take different action. So in a nutshell, you don't fight a story with data. You fight a story with a different story. And what was fascinating, even hearing Rashid, I was not there for the beginning, but hearing Rashid telling these experiences in a form of a story, and of course he was trained by us to do that, but I really appreciate you putting it into practice. You can see how when people are told a different narrative, a different story, that enables them to take action in the communities that we serve and that we are part of. And, if you are interested in this, like I'm not going to spend too much time, but there's actually a scientific explanation for this. when we are processing different things in the world, we are on one side having a logical side of things, of head, we are processing things intellectually. On the other side, we are processing things emotionally with our hearts. The language of the head or the intellectual processing is evidence, is data, is that type of thing. That's the language. The language of the heart is the stories. And they've been like that like for centuries. What is really interesting that we miss many times is that in order to take action, to make choices, you need both. You need information and you need narratives to enable your emotional side of things so you can take action. There's a wonderful article, well, interesting article, I would say, where people studied people who had a damaged amygdala, a place where there's an integration between the emotional side of things and cognitive side of things. And it turns out that they cannot do one thing, and that is that they cannot take action. They cannot make decisions because there's no integration between emotions and logic. And when people say like, oh yeah, we need to take an objective decision, I honestly feel like that is a false way to look at the world, because there are no such things as objective decisions as human beings. We make our choices based on the information about what is going on in the world and based on the emotional significance of these things. And the emotional significance is usually translated through stories and communicated through stories. The other way to describe that is that when you experience the moment of something going on, let's say imagine the first time when you've heard that the COVID pandemic is beginning. We didn't know anything about that. We didn't have any experience of that. And that was a moment of uncertainty. And if I ask you, if we have more time, if I ask you like, where were you at that moment? I bet like a lot of people could remember the specific places, specific stories of them hearing the news. Oh, there's this new virus, and we don't know what it is, and it's going to affect health workers and whatnot. So when we experience moments like that of uncertainty, it creates an emotion for us, and that emotion is activating our values. It's basically saying like, okay, I need to do something about this, and as a result of that, you take action. The stories, when you think about them, do the same thing without you having to experience the moment. When you listen to a good story, there always like is a moment in that story, and then there's like, let me think about what emotions does it create and what type of actions I can take as a result of that. So this arc that is natural, that is we experience it every day. When you encounter a new piece of information, some type of uncertainty, something that is new, that happens in a story all the time. And that's why human beings are interested in stories. Not because, like, for example, like, I don't know, in my faith tradition, there's, the story of David and Goliath. Like, people know that story. There's a giant and there's like a shepherd, and they're kind of, and, why there's a long history of that story that exists out there. I don't think people are interested in that story because they want to learn specifically how do you fight giants, because there are no giants around us, but yet somehow we tell these stories because the meaning of the story is what matters. We are interested in what it takes emotionally to deal with a big challenge. If you are a shepherd, if you're someone who doesn't have the power of the giant, and you can think about like I worked with a lot of nurses, across the globe. Every single day, that is the story of the nursing experience. Emotional facing of the giant. Either you have a patient that has a big problem, or you have a community problem, or you have an organizational problem. Those are big giants. And when we listen to stories, we want to understand emotionally what it takes to deal with these things, because that is what enables us to actually take action. And that's why stories are so powerful in many ways. In leadership in particular, and this is where I will end and leave you with this. When we teach and introduce narrative and stories as a leadership practice, we invite people to think about 3 different elements. We invite them to think about the story of self, why it matters to me, why this moment is relevant for me, what I can, how I can learn about my own values and my own kind of like significance in doing this work. I unfortunately feel that clinicians, both nurses and doctors and social workers and community health workers, are somewhat in the public professional spaces deprived of the ability to tell their own story. You know, you will hear a lot of stories about patients, but nobody is asking our health professionals to tell what is their experience of the health system and why it matters to them. What is their story of self? Because somehow it's regarded as like, oh, being selfish if you tell your own story. And I don't think it's selfishness. I think it actually gives people a chance to remind themselves why they joined the profession in the first place. What was their motivation? What was their drivers that took them through the really difficult training and almost like difficult everyday experience of treating and working with patients and communities. And that story of self matters in grounding us what it's possible, what we can do together. But if you just stay with the story of self, there's a problem then it becomes a selfishness thing. So then we invite people to think about what is the story of us as a community. Nursing Now Challenge is one of the best communities that I've seen, like of like a global communities, connecting people across the globe in this experience of usness. We have a common story here that is us as nurses, us as clinicians. And then finally, once you have these 2 elements, there's a third story, which is about the current moment, what is happening right now. And that third story is about how do you invite the people to deal with the immediate challenge that is in front of them. That is the story of now. And the story of now is constantly changing. 3 years ago, like when we did a training with this community, it was about COVID and vaccination. Now it's a different challenge that we are facing, and tomorrow is going to be a different challenge. But again, these 3 elements, like understanding where you're coming from, why do you care, why do we care as a community, and then what is the current moment that we need to deal with, that kind of constitute the narrative and stories that you can use and tell to other people that can empower you and others to be much more successful in public spaces in changing the policies and your environment for the benefit of our profession, our caregivers, and also the communities that you serve, like patients and communities that you serve. So I will stop there, but I hope this was useful, and I really invite you to join us in these conversations and think about stories as something extremely valuable for your practice, both as an advocate and as a clinician, and that can really, really change how things are shaping in the outside world. So Aisha, back to you.
Wonderful, wonderful. Oh my goodness, I'm in heaven listening to this. And it's so fantastic to see you citing the wonderful work of Marshall Gans that I teach myself, and this whole story. And for those of you who don't know this work about the story of us, the story of now, etc., it's wonderful. And everything you've said, Pedja, speaks to the heart, to the soul, to the very bit that drives us as human beings and individuals. And I'm so delighted. And you said that Nursing Now Challenge is probably the best example. And we've been on the call this morning with a journal who wants to do a story on us, and we were trying to explain to her what this thing was. And I call it stardust or magic. And I said, the thing is, I can't tell you, you have to listen to the stories of these nurses. That's when you'll understand what Nursing Now Challenge is. So it's so wonderful. And thank you so much. And we're going to move, we were supposed to have the wonderful Amy with us, talking about crafting your concept note. For technical problems, she's not been able to, but we will get that in note format and sent out, or we can pick that up in our next session. But really think about what Pedja has said, and that storytelling is so important. So we're going to, I think if there are any last few questions, I know we've got a minute left here.
Aisha, I think Sana was going to say a quick word.
Oh, lovely, lovely. Sana, thank you. I'm not deviating or being naughty because it's not on the agenda, so I feel okay. But Sana, yes, over to you. Thank you.
No worries. Thank you, Aisha. Just trying to cover up Hemi. So, so just thank you, everybody. It was so amazing to listen to your stories, Fatima, Rashid. Thank you, Marisa, for this informative session. And Petja, thank you so much. That was amazing to hear. And yes, nursing now has changed lives and experiences. So many young nurses around the globe, including mine. So that's one of the platforms. And to all the amazing nurses and midwives listening to you, listening here. Marisa already covered this part, but I just really want to ask you to share your concept notes. You are on the front line. You know the experiences directly. You know the problems as well, and I'm sure you know the solutions because I worked as a vaccinator for polio in Pakistan directly, and by airing the patients the reasons for refusal, I came to know like they were not big reasons. It just needed someone to answer them properly, to communicate. And as a nurse and midwife, they had their trust on me. So I was able to vaccinate their kids after having a good conversation with them. So because the element was to raise awareness, and that's where we can also do and apply the same for HPV vaccines uptake. And I'm sure you know the problems. You have amazing ideas to tackle those problems, to come with a solution. So 13th December is our deadline. So you all you need to do is submit a short concept note of the solution, and all the guidelines are on the website of Nursing Now. And I has shared a link on the chat as well. And it's a great opportunity for you all to share your innovative ideas to the world. And then, of course, the winner will have the opportunity to present the ideas to the Global Partners meeting. And I'm sure this will be one of the life-changing experiences for you. If you can see the others winners of other global solutions platforms had experiences of changing, and now they are leading in so many initiatives. That's the platform for you. So go for it, and good luck. Thank you.
That's how you do it. Fantastic, Sana. Okay, you've had that call to just do it. So we're going to just finally hear from Marisa again for that last minute challenge, 2 participants for some final words. Marisa, over to you.
Thank you so much, both to Sana and Aisha. I could not agree more with what Sana shared. And this mini challenge, this third and final one, is actually really designed to help everyone in those final pieces and putting those final pieces together of your concept notes. So our our 4th session on December 5th will be sort of a writing workshop where we really want to be there to answer remaining questions that you have that can help tie up the bow on your concept notes. So for the 3rd mini challenge, what questions do you still have about HPV prevention and cervical cancer prevention? What additional information or guidance would be helpful to complete your concept note? If you post your responses to this in the Facebook group, we can use that to guide our discussion on the 5th of December so that we can make sure we're answering all of your questions and providing as much information for everyone. But thank you so much for joining us today, and excited to see you all next time. Back over to the Nursing Now team.
Thank you so much, Marisa, and to Sana and Pedja and our wonderful speakers, Rashid and Fatima. Very inspiring session today. Thank you so much for your time in joining us. Please, please do this. This is one of the ways that the world will get to know the potential and the impact of nurses and midwives in our communities. So please do it. And thank you also to our team in the background there, Hannah and Faye, for making this a wonderful event and setting it all up for us, and so that we all know what we're doing, especially me. But have a wonderful Friday and take care. We will see you on the 5th of December. And please take the direction from Marisa, etc., on what to do next. So we'll see you soon. Take care. Bye.